Hi everyone, I'm going to try to be as quick and succinct as possible without leaving out much information. So my name is Dr. Nicole Porto. I'm a biology professor and I am also the coordinator for the public health and community health education major. Next fall, I'll be teaching Introduction to Community and Public Health. I'm sure many of you have heard about public health ad nauseum because of this COVID-19, but public health is very much an important field, and no, I'm not being biased, right? As we know, public health can be defined as the science of protecting the safety and improving the health of communities through education, through policy making and research for disease and injury prevention. And again, a more relatable example, right now we're in the middle of a public health crisis, right? This COVID-19 pandemic, and we'll be talking about vaccines and vaccine hesitation, misinformation, different concepts within public health, such as health communication, health promotion. And this is what I love to bring into class, where we're talking about different types of messaging, right, when it comes to certain health issues. We will also be covering key concepts within environmental health, and we will be looking at a particular book, What the Eyes Don't See by Dr. Mona Hano Atisho, and it's a very good, very riveting story about the Flint water crisis. And this is something that is still going on, right? Even though this happened more than 5 years ago, where there was a deliberate poisoning of a community, and particularly a poor, underserved community by the local government officials as well as the states, right? Because even the EPA knew about it and they continue to poison, to have these people being exposed to lead. And we'll talk about that as well. So we're going to be delving into the different policies and different areas of public health in terms of health prevention and education, because we want to ensure that we build strong communities, healthy communities, resilient communities, regardless of differences in terms of race, gender, whatnot. We want to make sure that health is not just only, I shouldn't say not only, health shouldn't be a privilege. Health should be considered a right. And that is like one of the key foundational, I would say, topics that we try to focus on or and center on. That health, good health, should be accessible to everybody, regardless of their background, regardless of education. So I hope to see you next semester as we try to answer so many questions that are very much pervasive within healthcare, within public health. And you can also bring in your questions and we'll try to answer it as well. Okay, see you.